Good morning and thanks for watching the Market Day Report. I'm Janet Adgeson. Well, a new Congress is setting their priorities for 2019 and freshman lawmakers from farm states are working to bring their state issues into focus. RFD-TV's Sarah Mock sits down with Iowa Representative Cindy to see how she's bringing rural health concerns to the nation's capital.
So you just did a rural hospital tour in your district. Could you talk a little bit about kind of what you saw and heard on that tour?
Yes, well, first and foremost, healthcare is very important for our district and quite honestly for people across the country. But in particular in our rural areas, we are lacking a lot of adequate opportunity to provide people what they need to live healthy lives. And so we decided it was important to go out and find out what was happening in our district, and we took an 8-county tour, starting out in Redfield, going to a clinic that's owned by a physician's assistant, and talking with them about the issues that they're facing. Redfield has, I think, 835 people, if I'm correct, and a very limited opportunity to find health care. And what we saw in Redfield in particular was a lack of funding because of the type of facility it is, a rural health care clinic. And that lack of funding unfortunately means they're not able to provide some of the services that are necessary and certainly not keep some of the prescriptions available that people need. And that means then people in our rural community have to drive a lot farther. And across the board, of course, we saw prescription drug costs that people can't absorb. We heard stories about parents who, people who didn't get the prescriptions that they needed because they needed to make sure that they put food on the table.
So talk about how you're bringing that back to Washington, and what does that mean in terms of legislation you're prioritizing this year or activities you're planning to do here in the nation's capital?
Well, one of the things that I'm really trying to do is raise awareness of our rural communities. We have a Shopco that's leaving one of our communities right now, and that's the only pharmacy in town. So now we don't know what those people are going to do. So we're going to have to figure out what that solution looks like. And I want people to understand here in the House who might come from much larger areas, more populated areas, that there's in many cases a crisis in our rural communities, whether it's healthcare deserts, whether it's the unaffordability of it all, or whether it's just the fact that we have to drive so far to get to some place that for people who are working a full-time job or 2 jobs to make ends meet, that's something that they just can't do. So I'm trying to raise awareness around this issue, raise awareness around support for our rural communities, ensuring that we continue to support things like expanded Medicaid subsidies that help keep our rural hospital doors open. Those are not just, it's not just the right thing to do to make sure that everybody can get the health care that they need. They're also key economic drivers in those communities as well.
Well, coming up at 11 Eastern this morning here on the Market Day Report, the Congresswoman will break down her goals for the House Ag Committee and current trade issues. Well, a recruiting challenge offers balance bipartisan